My name is Joel Burnett. I'm an internal medicine physician in Portland, Oregon, and I'm here to talk about my Copello Fellowship capstone project, Our Lane, Our Time, Addressing Gun Violence as a Public Health Issue. Unlike some gun safety advocates, I haven't been touched personally by gun violence in a serious way, but I've reached the same conclusion as all gun safety advocates. Enough is enough. We need to do more to address this public health crisis. My interest in gun violence prevention arose in 2020 when I became a father. When Theo was born, like many first-time parents, I found myself doing whatever I could to keep my child happy, healthy, and safe. In this context, I was shocked, as many were, to learn that the leading cause of death among children in 2020 is firearms. This set me on the path of making Theo's world a safer place. And it turned out there was plenty of work to do. Homicides in Portland had hit record highs in 2020 and 2021, and yet 77% of gun-related deaths in Oregon were suicides. In 2020, there were 592 gun-related deaths. And many more people in Oregon were injured by guns. There were 730 ER visits for gun injuries in 2020. There were 873 in 2021. With that as background, I sought out the DFA Copello Fellowship to learn more about how to make change in my state. My goal was to pass evidence-based laws that reduce firearm injury and death during the 2023 Oregon State Legislative Session. I picked up skills during the fellowship and applied them to reach the goal. Skills like power mapping, identifying allies, organizing, engaging media, and influencing lawmakers. Let's start with power mapping. Mapping power helped me understand who holds power and what they plan to do with it. In my case, I used this knowledge to figure out which gun safety bills had sufficient political will behind them to become law. Dozens of bills addressing gun violence were introduced during the 2023 legislative session. But lacking insider knowledge, I didn't know which bills were likely to move and which were likely to be stuck in committee. But I followed the papers, and when I saw that two powerful figures in the state came out in support of specific legislation, I started paying closer attention to those bills. They were bills addressing prohibitions on ghost guns, restrictions of guns in public places, and raising the age of purchase for guns. It became clear that those were going to be the bills addressing gun safety during the 2023 session, so I started organizing in support of them using some of the organizing skills I picked up from DFA. But DFA was actually even more helpful because I was able to submit an advocacy alert to DFA members in Oregon, urging them to contact their legislators about these bills when they came up for a vote in the House and in the Senate. So DFA actually became not just a teacher, but an ally in getting these laws passed. And I sought out other allies employing the same tactic. I created a similar advocacy alert that was sent to members of the Oregon chapter of American College of Physicians. Organizing and identifying allies was valuable for more than just action alerts, though. It was also useful for speaking to legislators via testimony in committee hearings. I worked with my professional society to submit testimony in support of the proposed gun safety legislation, and I was also able to work with my colleagues across my institution to submit testimony in hearings supporting the legislation. By this time, I had learned to follow the legislative updates in the media, but I hadn't otherwise engaged with media. Learning the op-ed and LTE writing skills from the Copello Fellowship gave me the confidence to submit a letter to the editor to the local paper, The Oregonian. It was accepted and it ran, and I wasn't sure if anyone would read it, but to my surprise, a few of my patients actually thanked me for writing it and thanked me for the work that I was doing. All of the advocacy skills I was learning were put in the service of influencing legislators to pass this legislation. And it turned out, thanks to the work of many advocates, the ghost gun prohibition bill did pass. It was signed into law in August, and it's been a big win for public safety and gun violence prevention in Oregon. It was thrilling to see the advocacy work pay off in the end. And yet it was also the journey itself that was inspiring and rewarding. I learned valuable lessons for advocacy along the way, including the importance of amplifying the message, building teams, valuing relationships, and the importance of persistence. Persistence in advocacy really does pay. Thank you so much for your time.